Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing plastic surgery or cosmetic surgery in the Scottsdale Paradise Valley area since 1992. I only perform cosmetic surgery, and people of all ages and all backgrounds come in. It's not something only for the rich and elite anymore. People find that if they have the time to recover and if they can come up with the financial resources, they can have the surgery. I do facial, I do body surgery, all over the body. And people often ask me, independent of what their age is, how much surgery can be performed at once, and how much is too much in terms of procedures. The main thing to understand is that plastic surgery is still surgery, and there are risks and possible complications with the surgery, and we try to minimize those risks and try to make it safer for you. The number one thing that we try to do is make this a safe, pleasant experience, and oftentimes I will give patients information that they don't want to hear, and that is, this is too much to do at once. How do I decide that? The main thing to first understand is chronologic age is not the same as physiologic age. So I've had patients that come in that are in their 70s and really are as fit as a 40-year-old. I've had 40-year-olds that may have medical problems, they may have diabetes, they may have lung disease or heart disease. With that in mind, we try to figure out what the best course of action is. Generally, we like to say that a cutoff for surgical time would be anywhere between 6 and 8 hours for somebody. We really don't like to go much longer than that. And generally for body parts, we tend not to like to want to do things like facelifts with multiple areas of liposuction or tummy tucks or things like that. We tend to like to combine body sections together, both for your convenience for recovery and also for safety matters. Anybody that comes in with any kind of medical history, we like to get the doctors to give some kind of medical clearance and try to optimize the surgical pre-op presentation. So with regards to how much surgery is too much, I think it's a very individual kind of decision, and I think it's one that needs to be discussed personally with your plastic surgeon. Again, we try to group areas of the body together. We try to not to have the surgery last more than 6 to 8 hours. And what is so nice about elective surgery is that, let's say we decide to do a facelift, in about 3 or 4 weeks you're going to have the body work done, and that is convenient, it's safer in certain patients, and it ultimately works out to your benefit. Thanks a lot.